Good morning, everyone, and welcome. We are doing just some minor cases today in the minor procedure room, and I want to thank you very much. I will not mention your name, but thank you very much for letting us film right now.
Yeah, of course.
Isn't that nice? It's very kind of her. May, I'm going to talk about your case if that's okay.
Yeah.
And her case is very interesting. She had a scar. How did you get that scar?
I had shingles when I was in high school and accidentally put acne cream on it, and it basically left a horrible scar on my face.
And how big was it, you would say?
I would say maybe almost, I don't know, an inch?
Yeah, an inch long, and also how wide?
Like half an inch wide it must have been.
Yeah. And so, the challenge here is that I can go ahead and remove something an inch wide, a half inch wide or so, and an inch long, but it's going to give her a scar that's almost an inch and a half, maybe an inch and 3/4 long, bigger than what she already had. It will be a finer looking scar, a finer looking incision line than what she had, but nevertheless a longer one. So we elected to do a technique called serial excision. And with serial excision, what I'm basically doing is I cut out the inside of the scar, leaving around maybe 50% of the scar still there, but I don't extend the excision, the amount that I removed the first time, beyond the confines of what the original scar was. And then we let it heal. How long was it? We let it heal how long?
I think just maybe 2 months.
Was it 2 months or so?
I think so.
And then we let it heal, and now the scar is still 1 inch long, right? But now it's only like 1/4 of an inch wide. So she's coming in today, and I'm doing the second stage. And my intention this time, honestly, was to remove ultimately what would be around 95% of it, so that there would just be a little bit left that maybe we have to take off. And I'm actually surprised to tell you that as I'm putting this together, I think almost everything came out. I mean, you may not need another stage.
That would be awesome.
Yeah, that would be great. I always like to under-promise and over-deliver, so I think that's relevant in this case right now. And this is the last stitch that I'm putting in deep. These are deep sutures that will ultimately just dissolve, but they're able to stay in there for some time so that it keeps the edges opposed to one another. There we go, good. And then, now I haven't put the final sutures in, but for our Instagram followers and friends and movie, if you want to come over here just a bit, hold on just a second, there's not really that much red stuff there, but just for whatever it is. If you come on over, okay, she originally, and I can show you a picture of this later, but she originally had a scar that went from here to here. Dab, please, 4x4.
Mm-hmm.
From here to here, and it was around that wide. And so the only way for me to take that out, if I needed to in one fell swoop, was to like come down like this into her brow and then come back up again, which would have left her a fine line here, but extending from up here and then possibly even going into her eyebrow, which would not have been favorable. So I just sort of did it piecemeal. I took a little bit, took it out and closed it, took a little bit more, took it out and closed it. And then finally, you can sort of still see that this edge right there might not be the most perfect edge, and that's because that's still a little bit of the scar. I suspect when this heals, that you're gonna love this, and you're gonna be like, Dr. Miller, I'm done, I love it, we can stop. And that way I was able to take out a scar that was 1 inch long and a 1/2 inch wide and maintain it within just a 1-inch vertical incision line. So there's your plastic surgery lesson for the day. I hope everyone enjoyed it. Thank you so much for letting me share that with our viewers. I really do. That was very kind of you.
Yeah, of course.
Yeah, I find that my patients are so sweet enough to pay it forward. Many of my patients now are coming from social media and Instagram. I view social media as an opportunity for me to educate both existing patients as well as new patients, let them know about procedures and also let them know a little bit about me and my office and how you would be treated and sort of what our perspective is, but also an educational tool so that you can learn a little bit more about plastic surgery techniques and concepts, which I, needless to say, love to do. So with that, have a great day, everyone. And again, thank you so very much for sharing and for paying it forward so that others who are watching might have the courage to come in and have what they would like done. Have a great day, everyone.